People today love to joke about medieval medicine, as if it was nothing more than leeches, bloodletting, and doctors waving around herbs while chanting prayers. And to be fair, some of that reputation is earned. They absolutely did have some questionable treatments, like putting dung on wounds or giving you wine mixed with crushed emeralds to cure stomach problems. But if you look a little deeper, medieval medicine wasn't just superstition and guesswork. It was full of surprising innovations that laid the foundations of healthcare centuries before modern hospitals and pharmacies. The first thing that may shock people is that medieval medicine wasn't built on chaos. It was built on knowledge borrowed, traded, translated, and refined. Long before universities taught biology and anatomy, monasteries were operating as early research centers. Monks spent countless hours copying medical text from the Greeks, Persians, and Arabs, preserving information that would have otherwise vanished during war and political upheaval. Without these scribes, much of the ancient world's medical knowledge would not exist today. The medieval world also believed strongly in public health, though they didn't use those words. Cities began regulating where butcher shops could be located to keep disease away from fountains and wells. Waste disposal rules weren't always perfect, but they were some of the first attempts to control sanitation. When the Black Death hit in the mid-14th century, many cities established quarantine procedures that are still used in updated forms today. Venice required ships to wait 40 days offshore before passengers could enter. Quarantine literally means 40 days. That idea came from medieval regulation, not modern science. And while bloodletting is the poster child of medieval mistakes, it wasn't the only trick in the medical toolbox. Herbal knowledge was vast and in many cases, surprisingly effective. Willow bark was used for pain relief, which modern scientists eventually turned into aspirin. Mint helped digestion. Garlic worked as an antimicrobial. Honey was used to treat wounds because it prevented infection. Many of these remedies were discovered through observation over centuries, not randomly. Women healers, midwives, and herbalists carried much of this knowledge in their heads, not in books. Their treatments didn't always survive in official records because most of them couldn't write and many weren't allowed to. Yet their remedies cured everyday illnesses long before doctors with university degrees arrived. Another surprising area of innovation was surgery. We imagine surgeons in the Middle Ages as butchers with knives, hacking without an aesthetic, which admittedly was sometimes true. But some medieval surgeons were far more advanced than we think. In the 10th century, an Islamic surgeon named al-Zarawi wrote a 30-volume medical encyclopedia that included detailed sketches of surgical tools, over 200 of them, many of which resemble tools we still use today. Trepanation, the act of drilling a hole in the skull to relieve pressure, sounds terrifying, but medieval surgeons performed it successfully enough that many patients survived. We know because archaeological evidence shows bone growth around the openings, meaning the patient lived long after the surgery. Eye surgery was another surprising specialty. Cataracts were removed using a method called couching, which involved using a sharp instrument to push the cloudy lens aside so the patient could see again. Not pleasant, but life-changing when the patient was nearly blind. While Europe often gets most of the discussion, medieval medicine was truly global. In the Middle East, hospitals known as bipartisan offered free treatment and kept medical records. Persian scholars diagnosed diseases like smallpox and measles centuries before Europeans recognized them. In China, acupuncture and herbal therapies developed systematically through trial and documentation. In India, Ayurvedic medicine categorized illnesses by body energy, diet, and balance, concepts that still influence wellness practices today. Back in Europe, universities slowly became medical schools. Places like Bologna, Padua, and Montpellier trained physicians who combined old knowledge with new observations. Anatomy became more accepted, dissection less taboo. The first autopsies took place not out of curiosity, but out of legal necessity, to determine cause of death. But these examinations opened doors. People began asking questions, noticing patterns, comparing bodies. Slowly, medieval thinking shifted from simply believing what was written to observing what was seen. That change was small, but it was the start of scientific thinking. And then there was the doctor-patient relationship. We picture medieval physicians as cold, distant, or strange. But many written records show a surprising level of compassion and psychology before psychology existed. Doctors were trained to treat the whole person, body, mind, and soul. They believed emotions affected health and prescribed music, conversation, or rest as actual treatment. They used gardens not only for herbs but as peaceful spaces where the ill could recover away from stress. Were they always right? Of course not. Some techniques were dangerous, some superstitions stubborn. Magic charms, astrology charts, and prayers were used alongside practical treatments because people lived in a world where science and faith were not rivals. They existed side by side, but calling medieval medicine ignorant misses the point. They worked with what they understood and used what they had access to. In a world without antibiotics or painkillers, without microscopes or germ theory, without refrigeration or sterilization, any medical system was fighting uphill. And yet people survived, recovered, and learned. Every mistake taught a lesson. Every cure was recorded. Every epidemic changed how communities responded. In many ways, medieval medicine wasn't the dark void people imagine. It was a bridge between ancient theory and modern science, between superstition and experimentation, between faith and observation. And while we like to comfort ourselves by thinking the Middle Ages were filled only with ignorance and strange remedies, the reality is more complicated. The Middle Ages preserved knowledge when the ancient world burned. They experimented when nothing was certain. They built institutions that resemble our hospitals and universities. They studied herbs that became modern drugs. They practiced surgery when others believed it was unthinkable. And the deeper you look, the more you begin to realize something surprising, that medieval medicine wasn't the end of ancient knowledge, but the beginning of the world we live in now. Even though medieval doctors didn't fully understand infection, they were constantly searching for ways to stop wounds from rotting. They didn't know about bacteria, but they definitely noticed what caused faster death. That's why they tried wine as a disinfectant, vinegar to clean tools, and herbs with strong smells to keep foul air away. They believed disease traveled through bad air, which was only partly wrong. Foul air wasn't the killer, but poor sanitation absolutely was. In a strange way, their misunderstanding still pushed them toward cleaner environments, better ventilation, and burying waste away from water sources. In some monasteries, there were written rules about washing hands before treating the sick, not because of germs, but because cleanliness was linked to spiritual purity. The result, though, was unexpectedly good. Clean hands meant fewer infections. You could call it accidental innovation, but it still worked. What might surprise people today is how much medieval medicine valued observation. An experienced physician became valuable, not because he memorized old texts, but because he noticed patterns. He knew which herbs helped headaches and which made things worse. He could smell someone's breath and detect certain illnesses. Medieval doctors listened to the body because technology couldn't do it for them. No stethoscopes, no x-rays, no lab result, just sight, touch, smell, and instinct, which may sound primitive, but it trained them to pay attention in ways modern medicine sometimes forget. And while the theory of humors, the idea that health was controlled by the balance of bodily fluids, seems outdated now, it's worth remembering that it forced doctors to think holistically. Diet, sleep, stress, age, climate, even personality was considered part of treatment. Today we use different words: mental health, nutrition, lifestyle, but the concept isn't as far removed as people assume. Doctors still tell patients today to change what they eat, reduce stress, get sunlight, and rest. Medieval physicians said the same, just through a different lens. Childbirth was one area medieval medicine approached differently than most people believe. Professional midwives, not male doctors, handled births. These women learned through generations of experience. They used warm oils for pain relief, herbal teas to reduce shock, and birthing stools that allowed gravity to help. Some of these techniques were more effective than lying flat in a hospital bed, something that remained normal until late in medical history. Sadly, midwives often faced suspicion, and when superstition collided with fear, many were accused of sorcery simply for being skilled. Knowledge was powerful, and sometimes too powerful for comfort in fearful times. Dentistry, yes, even dental care, was practiced in ways that would shock people but also show surprising skill. Tooth extraction was the most common procedure, not because they wanted to remove it, but because infection from a rotten tooth could kill. Barbers, the same people who cut hair, handled many minor surgeries, including teeth, because they already worked with blades. They weren't always clean, they weren't always careful, but they were essential. Pain relief varied: poppy sap, alcohol, pressure points. Not perfect, but not hopeless either. Mental health wasn't ignored the way people assume. Medieval physicians believed emotions and thoughts could make the body sick. They treated melancholy with music, companionship, better food, comedy, nature walks, treatments that echo therapy methods today.
The belief that community, conversation, and environment affect well-being was already there, long before neuroscience could prove it. And there's something else rarely mentioned. Hospitals existed, but they didn't look like ours. They were places for rest, food, prayer, and warmth, not crowded emergency rooms. Many were run by religious orders who believed caring for the ill was a moral duty. A patient might be offered herbal remedies, warm blankets, clean sheets, and someone who checked on them regularly. That level of care alone saved lives. Even today, nurses say basic comfort is often as important as the medication. Of course, medieval medicine still made mistakes, serious ones. Bloodletting sometimes killed instead of cured. Treatments were based on theories that sound absurd now. Many illnesses went untreated simply because no one understood them. But history isn't about measuring the past by our standards, it's about understanding how people survived with what they had. The truth is, medieval medicine advanced because people were relentless in their curiosity. They watched, recorded, experimented, adapted, and argued. They disagreed with each other, loudly. Scholars debated treatments in universities, surgeons carved new paths after battlefield experience, herbalists continued the traditions of their ancestors. Knowledge moved slowly, but it moved forward, and the world after the Middle Ages was shaped by those messy, flawed, brilliant attempts. Without medieval translators, the works of Aristotle, Hippocrates, Avicenna, and Galen would have vanished. Without the hospitals of the Islamic world, Europe would have waited centuries longer to build its own. Without herbalists, many modern medicines, including aspirin, morphine, and digitalis, might never have been discovered. What people often forget is that innovation doesn't always look modern when it's happening. Sometimes progress looks like a monk copying a dusty book under candlelight. Sometimes it's a midwife handing down knowledge at a bedside. Sometimes it's a surgeon patching a wound with wine and linen because nothing else exists. The past is full of these moments, small, quiet decisions that echo through centuries. Medieval medicine wasn't a punchline. It was a beginning, slow, unsure, occasionally misguided, but absolutely essential. Behind the myths of leeches and superstition lived really problem-solving, real innovation, and real care for human life. And the more we look beyond the rumors, the clearer it becomes that even in the darkest centuries, people were trying relentlessly to understand the human body, to ease suffering, and to heal in the only ways they knew how. And that effort, imperfect as it was, shaped the medicine we rely on today.